And now I'm very pleased to introduce Dr. Nicole Didyk. Dr. Didyk is a geriatrician at Grand River Hospital and St. Mary's General Hospital in KW. She completed her medical degree as well as fellowships in internal medicine and geriatrics at McMaster University in Hamilton. Dr. Didyk supports older adults with complex health needs as well as their families, and I've no doubt you will want to hear more from her after tonight's presentation. The good news is you can easily access her expertise through her YouTube channel. Her video blog is The Wrinkle. It was on some of the posters, so you might already be familiar with it, and I'm sure she will mention it to you and give you the contact information for that. So welcome, Dr. Didyk. The Zoom is yours.
Thank you so much, Robin. Thank you for that lovely introduction and for doing such a good job setting up the privacy and telling everybody about how to navigate tonight. We're learning to do so much online, and I find I'm learning a lot during these COVID times as well. So I just really want to thank everyone for taking the time to attend tonight. I hope that you'll learn something, but I feel really humbled to speak to this group because I'm assuming that many of you are caregivers or care partners, and you are the experts in how to care during COVID. So I'm just sort of giving you my perspective on what I've learned through my own experience and through looking at some of the literature that I had available. So hopefully we'll all learn together. Now, as Robin mentioned, I do have a website. I would love it if you would visit it. If you haven't already, there's also a YouTube channel and a Facebook page. So if you use social media, there's lots of different ways to catch up with me, and there's a lot of resources on there about aging in general. Quite a bit of it is about dementia and the aging brain also. So if you have time to check that out, please do so. And you can also leave comments for me there if there's anything you want to ask or talk about. So I can't do medical care over the internet, not on The Wrinkle anyway, but I can definitely give you some medical information and medical education. So today we're just going to talk a little bit about how COVID has affected those living with dementia and their care partners. The language that I use, I will say care partners or caregivers. I know that caregiving isn't just a one-way street. The people who are receiving care definitely reciprocate a lot of the care. But you know, that's the language that I'm going to use. So I hope that that's okay with everybody. And then, so we'll talk about the impact of COVID, and then we'll talk about strategies for staying well and for caring well. And I'm going to break that down into two components. So the one is what I call emotional personal protective equipment, or PPE. It's emotional and physical equipment or strategies that you can use to kind of keep yourself safe during this time. And we will talk a little bit about planning ahead, because a lot of us kind of went into sort of a survival mode, I think, when the pandemic started, but we need to, even in doing that, I think we need to think ahead and plan ahead. And a little bit of planning can really go a long way if things do change quickly. So we'll touch on that as well. So, you know, I don't have to tell you about COVID. We all sort of know the facts, but it's basically COVID-19 is the illness that's caused by the novel coronavirus, or it's also, you might hear it called SARS-CoV-2. It's basically the virus that causes the common cold is a coronavirus, but this one is different and it can cause severe illness. The first case was December 31st in Wuhan, China. And then a few weeks later, we had our first case in Canada. So on January 25th, there was a traveler who had come from Wuhan, went to Toronto, and was diagnosed. You probably remember the Princess cruise ship, where there were many Canadians were quarantined, and that was a very difficult thing. On March 12th, the Prime Minister's wife tested positive for COVID. Thank goodness she has fully recovered, but that was when Prime Minister Trudeau started working from home. And so did I. So on March 11th, I had a clinic that was at St. Mary's Hospital. March 11th, that clinic closed, and it remains closed and probably indefinitely. So all of my work moved online. Almost overnight, I was seeing people virtually by phone, by video, sometimes by Zoom. We eventually started using the Ontario Telemedicine Network platform, sometimes FaceTime. So really, it's, you know, my world, like many of us, moved into a totally different platform. And that was really weird, but I was thankful for the opportunity to keep working because it was a real anchor and a really good distraction. Meanwhile, this is what was happening. And so we've probably gotten really used to looking at graphs and charts and designs and things like that. So this is kind of the latest global picture of COVID. So we're seeing, you know, whoops, sorry, just hit the wrong button there. So we can see that the curve has kind of flattened, so to speak, but it's still a curve, and it's a long curve. And I think it's a much longer curve than a lot of us were anticipating. Here in Ontario, we're sort of in stage 3 of phase 2. And these things are changing all the time. And they do depend a little bit on where we live. So some of you might be joining me from Waterloo, Wellington, but some of you might be in another area that's sort of designated a hotspot by the government. So this can really, you know, make a difference in terms of what is open where you live. But for most of us, a lot of things are still closed. So a lot of programming, a lot of recreation centers are still closed down. We haven't gotten into that recovery phase yet. But of all the graphs and charts that we've looked at, they don't really tell the whole story. I really like this graphic, and you might have seen it, but basically it was made by a Dr. Singh, and he kind of mapped out, you know, we're used to looking at these graphs from the first wave of COVID and maybe even the second wave now. So we're used to thinking about the COVID illness, right? That's what we're all afraid of. That's, you know, what we're all modifying our behavior to avoid. And we're doing a pretty good job, I think, of flattening things down. But what about these other waves that are coming? And as a geriatrician, I'm very focused on these third and fourth waves. So, and even the second wave. So the second wave is what I'm seeing. A lot of people have put off getting the medical care that they need for their chronic conditions, but the chronic conditions haven't pressed pause. So they are still going on, and they need to be tended to. We've even sort of coined a phrase called NOVID, or NOVID. So you don't have the virus, but you have a chronic disease that needs care. And so you might not get COVID, but you might have NOVID, and NOVID needs to be tended to as well. So what I'm seeing are these third waves. And what I'm worried about is a coming third wave of people who have not been able to take care of themselves in the way that was ideal and are now needing more help to regain some of the losses that they had during COVID. And of course, a lot of us are facing this fourth wave of being traumatized, having exacerbations of mental health issues that might be new or might be longstanding but are flaring up. And almost everybody has some economic consequence of COVID. And some of us are at very real risk of burnout as well. Providers, but also care partners. So let's talk a little bit about caring. So even before COVID, caring is not a picnic. Caring is a huge role that so many people fulfill. There are 8 million unpaid caregivers or care partners in Canada, and 1 million of those are older adults themselves. More than 1 in 4 Canadians is a caregiver. And the value of the care that these unpaid caregivers are providing is probably around $30 billion annually. 80% of all care for older adults is provided by an unpaid care partner. And 1 in 10 care partners spend 30 hours a week or more on this task. And that comes at a cost. So we might be saving the government $30 billion, but 1 in 3 unpaid care partners are distressed. 45% of those care partnering for someone or with someone who's living with dementia are distressed. You're more likely to be a distressed care partner if you spend, or if you are distressed, you're more likely to spend 38 hours a week on caregiving activities. That's a full-time job. If you already have a full-time job, that's your second full-time job. So what time is left over for you? A distressed care partner is more likely to live with the person that they're caring with, and also to have the person that they're care partnering with is more likely to have personal care needs. So to need help with bathing, toileting, maybe even transfers, things like that. So there's definitely risk factors for care partner distress. A lot of the things, I mean, you can't be a care partner all by yourself. And so there are many, many resources and team members that help to support the care partner. But a lot of those things are on hold during COVID. So they've been on hold or they've been transformed significantly. So a lot of them have moved online, but it's not the same. And some of them just are not available. So things like respite stays, although some of those have been available, but definitely diminished. A lot of people have dismissed their PSW visits. So if somebody used to get 6 hours a week of respite so they could run errands or go to medical appointments or, do what they need to do, that's not happening anymore because of fears about COVID. Even family visits are being restricted, right? So if you have a family member, maybe they work in healthcare, you don't necessarily want to see them as much because you're afraid that they might bring COVID to you. And nobody wants to bring COVID to a family member who is already living with chronic disease or with dementia. Even worse, people are putting off their medical appointments. They're putting off visits to the emergency department even when they need to go. Some people are telling me there's an upside. So some people are able to work at home and they didn't used to be able to do that. So they're able to be at home while the person they're caring for is there. Some people find that that's an upside. They can spend less time commuting and doing activities like that. But overall, it's been very disruptive. And for sure, a lot of people are feeling the financial stress, and COVID is making that worse. People who are living with dementia are at higher risk of getting COVID and of getting ill with COVID, unfortunately. You can imagine it's so hard now. So whenever we leave the house, we have to think about our mask. We have to wash our hands. We have to keep our social distance. We have to, cover our cough. We have to plan our visits so that we're not, lingering or waiting in line or things like that. It's a lot to do. And so someone who's living with dementia has to adapt to all of those new activities. People living with dementia are more likely to be in an older age group, which we know puts a person at higher risk for COVID illness. Some people who are living with dementia might not have as easy of a time learning how to use technology because it is a learning curve to figure things out. I had trouble setting up this Zoom call. I needed to get some coaching to do that. And I think and I do video visits all day, every day now. So it's not that easy. Sometimes you're caring for someone and you can't do social distancing. If a person needs help transferring on and off the toilet, that can't be done at a social distance without a robot or something like that, which most of us don't have. Let me know if you have a robot. I would love to hear more about that. Or you may need to respond urgently and not take the time to do some of those infection control protocols. We're really afraid of, what I'm hearing is people are worried about somebody getting admitted to hospital who's living with dementia right now, because people who are living with dementia have a higher risk of delirium to begin with. And being in hospital without a visitor, it might be harder for the person with dementia to monitor themselves and then to advocate for themselves. So if they see their condition changing or they need something, it might be harder for them to get that point across. A lot of people I'm hearing are very afraid of long-term care right now. And a lot of the families that I'm working with would do almost anything to avoid long-term care. And, that's true a lot of the time, but it's really been enhanced with COVID. And these are the hard facts. So in Ontario, if we look at the total number of deaths, 65% of them took place in residents who are in long-term care or were living in long-term care. So the huge proportion of people who've had serious COVID illness and COVID-related death are in long-term care. And that's frightening for somebody to look at. Now, we're learning more about about that. We're kind of learning that the majority of the deaths are happening in a minority of homes. So probably only about 28% of homes have had someone pass away from COVID. But there have been outbreaks. So of the 625 homes, there's been about 500 outbreaks. 500 homes have had outbreak. So it's for sure something that's weighing very heavily on people's minds. Even if there's a feeling that the home will be safe, there's this 14-day self-isolation, which makes things more challenging, and nobody wants to think of their family member going through that. And then if they are able to visit, there's a concern about what's that visit going to look like? How many of us can visit? Does it have to be outdoors? I can't hug them. It's just, people would just rather avoid it. But the alternative can be equally daunting. So this is from the North Simcoe Muskoka Specialized Geriatric Services, and they kind of did some qualitative research, and they got some stories from some of the folks who are on the front lines. And definitely the story rings true to me. So imagine there are clients who are on the crisis list for long-term care, but because they might be roaming, so they might have a tendency to leave their home, or even just leave their room, that would be hard to manage in a long-term care home where there needs to be 2 weeks of quarantine. And so the clinician is wondering, how long are these individuals or their care partners going to stay out of hospital in these circumstances? Another story that I could relate to is, imagine it's a high-risk client who the family has to go out and shop without the client. But they unfortunately found the person had fallen while they were out last week. They're struggling with the medications. There's a risk of harm due to animal interactions. There's only 3 long-term care homes in our region, and there's rumors that these homes as well might even stop admissions. So what's going to happen? Are these folks going to end up in emergency departments or hospitals? And we are unfortunately seeing some of that. So basically, and this is something that I extracted from a talk by Professor Wang, who is a geriatrician in China. She gave this talk early on in the pandemic, talking about the experience there, and it's definitely what we're seeing here. So the unscheduled home life, so the lack of activities outside of the home, not going to day programs, not having care partners come in, maybe having new PSWs coming in, right? Maybe there are restrictions now and it has to be this person who's coming. There's less flexibility. There's a shortage of PSWs. We need so many more activities related to infection control that can lead to more interaction and more nagging and more, you've got to do this, you've got to put that on, you can't do that, you can't go out, this is why, 400 times a day. And then add to that the fear of long-term care or hospitalization. So it's leading to all of these things in the right-hand column. So boredom, sleep disturbance, I'm really hearing a lot about. Irritability, wandering, unfortunately, still happens. That break-in period or transition period with a new care, a new PSW or no PSW coming, transitions are hard, right? So they've been thrust upon us. We're seeing more people with mental health symptoms like delusions, anxiety, depression. And a lot of people are just avoiding seeking help because not knowing how to get it in a virtual way, thinking that everything is closed when maybe it's not. So it's a big setup for challenges. So what can we do? And, you are the experts on this. I am amazed at how well people are coping, how well families and communities are pulling together, and how well agencies like Alzheimer's Society have been able to pivot to provide care in different ways, to reach out, to do wellness calls, to do all kinds of things. When my clinic closed down at St. Mary's, we were able to get some support from some other people in other parts of the geriatric system. And they were able to support us in setting up appointments, calling people, doing wellness checks, looking at the people on our wait list and reaching out to support them. So it's been amazing. But what are the things that we can do and that care partners can do to look after themselves? So first, let's talk about that emotional PPE. And this is based on what the World Health Organization is telling people to do during COVID. And I've kind of adapted it for care partners of people who are living with dementia. And they're the 5 R's, because in medicine, we've got to have a little acronym or a little bunch of letters that kind of make sense to help us remember things. So the 5 R's are maintaining routine, reaching out, resisting unhealthy coping strategies, restricting access to upsetting information, and revisiting a successful past coping strategy. And there's a bonus one too. If you want to rejuvenate your skill set, I'm going to tell you about some opportunities to do that. So let's talk about maintaining routine. And these, you know, the first 3 months of the pandemic, I was in free fall. I mean, every day was different. It was just trying to survive, a constant feeling of anxiety and worry. My kids went on March break and never went back to school, figuring out how they were going to homeschool, no barrier between my work life and my home life, like just, you know, seeing people at home. That was totally different for me, even though they're coming in virtually. It was just chaos. And that went on for a good few months because we weren't sure when things were going to go back to normal. But as things stabilized, routine kind of came about. And so I developed little strategies where I would put away my laptop at the end of the working day, or I would stop checking my email at a certain point. I would leave my phone somewhere to charge, and I wouldn't check messages for 14 hours until the next day. So those little kinds of things have helped me to manage a little bit better. And that is important. Having regular meals, sleep, we're going to talk about in more detail, having some kind of structured activities. So I'm hearing from people as I do activity diaries with people, a lot of people have come up with a new routine where they're not, they're checking in with Alzheimer's Society activities and running those at a certain time of day, or doing some online activity, or going for a walk. Thank God it's been a beautiful summer. People have been able to go outside. So people are putting structure into their day. And that's really important if you can at all do it as much as possible. I'm hearing from people that there's more sleeping happening during COVID for some. Not for all people, but a lot of people are telling me about that. And some people feel that it's kind of a respite, right? If the person they're caring for is spending time in bed, hey, that might be time that they don't need supervision, or that the person can get things done, the care partner can get things done, or can sleep themselves. So I understand that, but I want to make sure that you know a little bit about sleep so that you can kind of decide which, if the trade-off of sleeping more is worth it for you. As we get older, according to the National Sleep Foundation, we probably need less sleep. So as people get older, there's reduced sleep efficiency. People spend more time in bed, but less time sleeping. So it's less efficient. People also tend to have a phase advance. So they tend to get sleepier earlier, tend to be early to bed and early to rise a lot of the time. So those can be normal changes, but if people are spending a lot of time lying down or in bed or in a recliner, and I love my Lazy Boy recliner, but it's so seductive. And if we spend that time not moving, we can get real physical consequences. So it can interfere with nighttime sleep. It can cause muscle weakness. It can even interfere with the bowels. So if people are too sedentary, they're prone to constipation. That weakness can lead to falls. It can worsen depression. So it's hard to sleep your way healthy as we get older, I've got to tell you. So if you want to get a better sleep, and again, it's a trade-off, right? But going to bed on time and waking up around the same time every day is really important, especially the waking up. That's really important to do. You can try to figure out what your natural rhythm is. So, if your day is more unstructured now during COVID, you can sort of see, okay, when do I want to go to sleep? When do I want to wake up? Someone who's living with dementia might have some disruption already in their sleep rhythm, so that you might need to impose more of the sleeping times. But you want to really reinforce that bedtime ritual, set up those psychological cues that it's bedtime because we're having our chamomile tea, or because we're listening to soft music, or because we're putting some lavender in the oil diffuser or something. So getting into those routines. It's probably not the time to try a sleeping pill during COVID. It's harder, most likely it's harder for your doctor to monitor the potential side effects of those kinds of medications. They can be habit forming, and they can have serious side effects. So it's not the time to start that. Please try to resist that and look for other ways to cope with sleep. And really try not to nap. I know it's lovely, but it can really kill your nighttime sleep. Try to schedule in your worry time. So that was a strategy I used this morning when I woke up early and I started to fret about this talk today and think about all the things that could go wrong. So I said, no, that's for worry time. Between noon and 1 p.m., you can eat lunch and you can, fret. So trying to compartmentalize, you're going to have time to worry, but it's going to be in that compartment. And then the rest of the time, you're going to think about more peaceful things or use some other strategies to clear your mind. Get rid of devices in the bedroom, electronic devices anyway. You can, if you've heard my seminar about sexuality in older adults, I'm not against devices in the bedroom, but I don't want them to be cell phones. I don't want them to be television sets. Your bed is where you sleep or have sex. So your bed is, you're reinforcing that psychological connection that's the place for rest. And I love this website. It's called mysleepwell.ca. It was developed at the University of Dalhousie in Nova Scotia, and it's got amazing resources. So it's got wonderful resources about sleeping pills, why they're not usually the best answer, alternatives to using sleeping pills, and some great advice about using cognitive therapy to help you sleep. A lot of it starts with sleeping a little bit less, or at least tracking when you're sleeping and kind of keeping a bit of a sleep diary. But it's an amazing website, and most of the resources on there are free. Or if you want to read some more books about sleep and that, they've got some really good resources there, as well as some links to some research papers. So that's one that I recommend all the time to my patients. Nutrition, I feel like a hypocrite telling you this. I think I've put on the COVID-19. I'm keeping Orville Redenbacher stock very high. But, paying some attention to nutrition is a good idea. We're probably shopping less, or we want to shop less. So using things that are frozen or canned, if you have the storage space, it's a great strategy. Frozen fruits and vegetables are just as good. I find them better than fresh. So, frozen raspberries are always good. They're not always good in the produce aisle. So looking towards those things, keep your snacks healthy. So instead of reaching for peanuts, maybe reach for carrot sticks, something else, an apple. Try to keep things healthy. Try to keep your meal times structured and try to eat together. So that kind of congregate dining, as long as you're both healthy, your family is healthy, it's a really good idea. It'll really promote healthier eating during COVID. Remember, obesity seems to be a risk factor for getting sicker with COVID. So a lot of people who've gotten very ill with COVID, the obesity is a risk factor. It seems to promote inflammation. So that's something I try to remind myself of when I want a cookie. I say, you know what, don't feed your fat. Don't get those inflammatory cytokines going. Choose something healthier and be healthier. Put in that premium unleaded gas. Here's another little booklet that I love. Exercises at the kitchen sink. And my kids sort of giggle when I started doing these, but they are fun. They're easy. You can do them anywhere. This is a little booklet from the Elgin St. Thomas Public Health. If you just Google it, there's a PDF that like a file that comes up that could be printed off, or you can just scroll through it. But doing these little things, do some push-ups off of your counter or off of the wall, and you'll notice, and try to do them at certain times. The other kind of exercises I try to do, just slot them in here and there, are the pelvic floor exercises, right? Those are good to do too. But just do them like when a commercial comes on, or when you're waiting for the wrinkle web page to load, just do a couple of things and you'll find yourself getting stronger, and every little bit does add up, and you'll feel your heart rate going up. You'll feel that sweat coming. So just doing a little bit. You don't have to run a marathon. You don't have to start doing, you don't have to get your black belt in karate, but just doing a little bit will make a difference. There are online exercise classes. So I did chair yoga last week and it kicked my butt. I was sweating. I thought it was going to be easy, but look at Mary Zadel here. She teaches the class. If you want to check out her class, it's wonderful. And she is so lovely. But that, those kinds of things, there's so many activities online. Minds in Motion is online. So a lot of things from Alzheimer's Society and other groups are online. If you can join me for this talk, you can do the internet. I know you can, right? So 60-70% of older adults have the internet, and half of those people use social media at least. So I know that you can do it. So give it a try. You can do Zumba, you can do all kinds of things, and just do it. Just do a little bit, or do it the same time every day. You'll probably find someone that you really like, that you want to follow and see more of. But it's everything is online. Your practice moved online, your exercise is going to move online too. The reaching out is really important, and I can't stress that enough. The Canadian Mental Health Association had a whole, and the Community Support Connections had a whole month of that, I think in the month of April, where they were saying, connect with others. It's so important. And there are places to reach out. Canadian Mental Health has a 24-hour helpline. You can call them at 3 a.m. when you're tearing your hair out. You can call here 24/7. Alzheimer's Society, if you look at the monthly guide, there's pages and pages of groups for all different kinds of support groups. There are dementia support counselors if you'd rather just talk one-on-one. So there are resources out there. There's different websites that have, online counseling and that, but just call 911 if you're feeling super desperate. Those resources are there for you, and we want people to reach out. We don't want people to suffer alone. You're not alone. There's 8 million care partners. There's some really good websites as well. There's caregiving.com. I love caregiver.org, the Family Caregiver Alliance. So many good articles on being a care partner, aging, dementia, so many good practical strategies. This one is from British Columbia, My Tools for Care. There's the Carers program at the Rotman Institute in Toronto. So there's so many, and almost all of these pages have links to other pages. And Alzheimer's Society, so Robin being an education specialist, she can tell you, find out, well, what is it that you're really looking for? Robin knows the resources. She can point you in the right direction. Caregivers Living Room is a Facebook group. So you do have to join and you have to be on Facebook, but it's free. And it's groups like that can be amazing. So a great way to just find community and to share tips, because you are really the experts, on what's happening. And sometimes someone can tell you something that worked for them and it can be a game changer. Or you could even just, find out that you're doing this, something's happening to someone else. You're in the same boat. I think that's tremendously helpful. So I recommend these sites. Try to resist unhelpful coping strategies. And I say this again as someone who's gained the COVID-19. But now is not the time to get into those strategies that are not helpful. If you're in recovery, this is the time to work those recovery programs. There are online resources as well for people in recovery. Think of it as maybe it's a time to take on new habits. So maybe it's a time to, start doing macrame instead of smoking or something like that, if you can order macrame supplies safely. So something where you're going to take on that new habit, try not to slide back into those old unhealthy habits, and try to restrict your access to upsetting information. So keep it, the first few weeks, I was like a junkie. I was looking at dashboards all the time, trying to look at this count, that count, like what, where are the hotspots, what's happening, what's the latest. I was reading all the research. And then after a few weeks, I just couldn't keep up anymore. There was too much. And so I focused, I figured out the 2 or 3 sites that I wanted to look at. You know, I want to look at the Ontario site, I want to look at the Health Canada site, and I want to look at the WHO site. And I only want to look, you know, once a week. And then I'm going to read articles or go to some educational events once a month about COVID. So keeping it very curated, and balancing that media consumption with more positive stuff. Keep the screens away from your dinner table, from the bedroom. Just keep it curated. A lot of people have CNN on 24/7. And if you're not getting COVID news, you're getting election news. And I don't know what's a bigger disaster, right? You don't want to hear either one of those things, probably. You want to watch videos about panda bears, puppies. You know, if I want to relax, I'll be like, what are the, you know, cutest puppies? Just search that in YouTube, and it's amazing, the beautiful, or like, you know, baby says I love you at 2 months old. Like, you know, if you search something cute like that, you'll find some really cute stuff, and it'll take your mind off of this difficult stuff. I'm hearing from people that they're able now to revisit their past successful coping strategies. So if meditation worked for you, if prayer or mindfulness or singing, you know, go back to those strategies that are successful for you. A lot of faith communities are starting to open up. A lot of them have gone online, but some of them, you know, most of them are having some kind of in-person service. If you think it's safe to go, again, it's a trade-off, right? So for you, if that's going to be an important coping strategy, then it's good to go back to something like that. So those are the 5 R's. And I know, you may not have learned anything new, but maybe that can just reinforce some of the things that you kind of know, that we know deep down, that they're a good investment. You know, they're hard to do, but it's hard to not do them and to feel exhausted and tired and out of control. If we can pick one of these things and work on it a little bit, it'll give us that little bit of control and a little bit of confidence, so that maybe we can start tackling another area. There's a lot to learn in caregiving, and there's a lot of wisdom in people who've been caregivers before. And if you want to rejuvenate your skills, this kind of sounds like it's something else to do. I don't want to give people more on their plate, but this is a really good course. It's run by the McMaster Continuing Education Department. It's free, it's self-paced, and it's all online. And so the modules are very practical. And it's run by one of the instructors is Donna Thompson, who you might have heard of. She's written the unexpected joy of the unexpected journey of caregiving. And she has an amazing website and Facebook page as well. But she has been a care partner for her son, who's living with a severe developmental disability, as well as for her mom before she passed away, who was living with dementia. So she's walked the caregiver walk, and she's such a good communicator. She can really share what she's learned. So if you have time, if you want to learn a little bit more, it might make the journey easier, then that's available. And I think it's a great resource. And there's so much to learn at the Alzheimer's Society as well. So almost any topic about caring for someone who's living with dementia, the Alzheimer's Society has a resource for that. And again, these are tried and true resources developed in collaboration with people who have that lived experience of dementia. So I can't say enough about Alzheimer's Society resources either. Definitely recommend. So that's the personal protective equipment for your emotions. And now let's talk a little bit about planning ahead, because this was something that came up a lot in COVID, the early days. And we were talking about what's going to happen if you have to go to hospital. What if you are in long-term care and you have to face that decision? Should you go to hospital or not? And a lot of people are thinking about this, and they're so afraid of getting help. And they haven't really maybe even thought about what they would do in that situation. And it can be paralyzing. So we're hearing stories like this. A patient reported a systolic blood pressure over 200, which is an emergency, but they didn't want to go because they didn't think they were allowed, or maybe they were afraid of what might happen there. So whether there's COVID or not, if you're a care partner for someone who's living with an illness or even if you're just, if you have any kind of medical issues yourself, now is a really good time to discuss that. So it might not be that, you know, you're sick with COVID and you have to think about what you're going to do, but it's always good to think about that when you're caring for someone. So I want to share, and I mean, I could say a lot of things, but there's other resources that have said it so well. So I want to play a couple of little videos for you. And this one's only about a minute long. It moves kind of quickly. I hope it doesn't make you dizzy, but this is, and you can find more at advancedcareplanning.ca. There's a whole bunch of resources and tools there, but this little video kind of explains why it might be important to start thinking about what your wishes are and how to plan ahead. And it gives you the steps to do that. So let's watch this. So that's really cute. And I have another one that I don't know if any of you have ever watched this video. It's a 3 good things. Again, this is pretty short. It's only about 5 minutes, but let's give Dr. Bach a listen. It's less than 5 minutes, 4.5.
I'm Tony Bach, a doctor in Seattle. And if you're a caregiver, there's something that I want you to know. What you do is so important. As a doctor, I can't thank you enough. This coronavirus thing is something that we are all going to need to work together to get on top of. A lot of you have been asking me, you know, we're already staying home. What else should I be doing? There are 3 other good things that you can do now. I just talked to a great guy about them. He's a caregiver for his wife, who's a patient of mine. And he loves to show me pictures of his garden. That's usually what we talk about. But this time, I went through my 3 things. He went home, did them, and the next visit he said, you know, it wasn't that hard. I feel like I just changed the batteries in my smoke detector. And I said, you got it. My 3 good things took him all of 10 minutes. Here's number 1. Are you the legal spokesperson for the person that you are taking care of if they somehow became too sick to talk to a doctor? That person is also called a healthcare proxy, and you would know that you are the official healthcare proxy or that legally appointed person if you have a document that is signed by the patient.
So in Canada, it's more called the substitute. Sorry, Dr. Bach, I kind of paused it at an unflattering facial expression there, but yeah, it would be more that you're the substitute decision maker or the power of attorney for personal care for the person. So it's just a little bit different language, but it's the same role.
That document is called a healthcare directive or a living will. Get a copy of that document. My gardener guy said, okay, I found it. And I said, okay, now tape it onto the refrigerator so you know where it is. If you're not the proxy, that's okay. Just figure out who it is and make sure you have their phone number. Making sure that the person you are caring for has a healthcare proxy means that no matter what happens to them, that they will always have a say in their healthcare. Number 2, Ask the person that you care for what they would want everyone to know if they actually did need medical care for COVID. Even if you're not the official proxy, it's good for you to know this because you're probably the person or one of the people who knows that patient the best. My gardener guy said, honey, I want to talk to you about healthcare for COVID if you needed it. I hope we never need to talk to a doctor about this, but if we do, I will make sure that they hear your voice. He said, tell me what matters to you about your healthcare now, and also what matters if things took a turn for the worse. Now, he told me his wife looked a little surprised, but he hung in there. He said, look, I care about you and I just want to do the right thing. Here's what she said. If I take a turn for the worse and I'm not going to make it, let me go in a comfortable way here at home if we can manage it. She had never said that before out loud. To me, as a doctor, that is a beautiful thing because it's so honest. She told him that because she trusted him. Other people might say different things like, I care about my quality of life, or I don't want to end up on a machine like a vegetable. Whatever they say, just take it in. You can ask a question if you're not sure you understand, but don't grill them. That makes people shut down. If you can, write down what they say so that you can remember it. And don't forget to say thank you. Number 3, ask the person that you are caring for what helps them feel safer and stronger. A lot of times these things are really simple. Like when my gardener guy asked his wife, she said, it would be a nice cup of tea with my best friend. And so what he did is arranged for her to have her cup of tea and talk to her friend on the phone every day at the same time. So they're doing that. My gardener guy had never been a caregiver until just a few months ago. He's been married forever. He said it was nerve-wracking at first, but now I can tell he's proud of the job he is doing. I told him that he was awesome, and you can be awesome too. We've got all this and more on a super duper tip sheet that you can find here.
So I love Dr. Bach, and I love how I'd love if you want to read his super duper tip sheet. He's so cute. He's so soft-spoken and so gentle. But I like what he said. And, you know, a lot of what, and the story that he's telling, it sounds to me like both of those people in that dyad are not, no one is living with dementia. So the person was able to express themselves pretty easily. And a lot of people who are living with dementia can do that too. But if, you know, so having these discussions might be a little different. They might take a little longer, and they might involve more just reflecting on what you know about the person, but filling in the blanks on what those questions are is really important. And I think it'll be something you can draw on if things change suddenly, or if something changes and you need to make some tough decisions. If you have that information to kind of draw on, it will be very helpful. And I think they are good things. So thanks for your attention to that. So really, I just want to say that our aim is for progress, not for perfection. Pick one of those strategies maybe, and just try to work on it for a few days and see what happens, and see if it makes things any different. Keep your goals simple. Keep your communication clear. As you're trying to work the strategies with your person who's living with dementia, work more on connecting rather than correcting, and listening rather than persuading, right? But I do want you to reach out, and I'm so glad you came today, because I think that that's a form of doing that, right? To sort of find community and get information and move forward. So that's all I had to share today. So I hope that it was helpful. I'm very happy to take any questions. And I'm so thankful to you for sticking it out to the end. I think Robin is going to help me with reading any questions that have come in on the chat. And I just want to thank you again for joining me today.
Well, we sincerely thank you. I know that you can't see everybody, and you can't hear them. They would be clapping their little hands off
Thank you.
If you could hear them.
We love that.
did have some questions and comments come in. And
okay, great.
So I'd like to just give them to you. I'm going to give them to you in the order that they came to me.
Okay,
so
great.
Back us up, if I could, to the point where you were talking about long-term care and admissions to long-term care. And one of the questions came in, if you could maybe elucidate a little bit more on why they're stopping admissions possibly to long-term care. I think that was a comment that people caught, and if you could unpack that a little bit.
Sure. So, I think so part of that was the quote from one of the people on the front lines whose perception was that, that in their region, there were only 3 homes accepting people and that might change. When a home is an outbreak, usually that means that they would be they wouldn't probably be accepting admissions, and things are changing all the time, right? So the latest directive is that the homes can accept admissions, but they do have to have this 2-week quarantine period. But again, if there happens to be an outbreak in that home or something like that, then that could slow the process down. And if you actually go to, if you just search like Ontario long-term care, you can see it. There is a dashboard that sort of tells you which homes are in outbreak and which homes are no longer in outbreak, and which ones had an outbreak and which ones aren't. So I am definitely seeing people admitted to long-term care, but we have fewer beds in long-term care too, because all the beds that all of the rooms that had more than 2 people in them, we're not allowed to have more than 2 people now. So that actually meant that there were fewer beds all around in the system. So the capacity has changed. But right now, homes can accept admissions as long as there isn't an outbreak and as long as the person can be in quarantine or social isolation for 2 weeks. That's my understanding, but it's changing all the time.
Yeah, good to have the clarification. Thank you very much.
Thank you.
I also think that you gave us some absolutely wonderful ideas around resources. And I just want to give another resource, if I could. I'd like to give a shout out to the Ontario Caregiver organization. They have some great resources, and I know that our counselors often recommend that. So it's just another one to add. Let's get back to the questions. But before that, while we're giving shout outs and promotions, you did talk about advanced care planning and how important it is, and I can't endorse that enough. We at the Alzheimer's Society Waterloo Wellington are doing an advanced care planning workshop on Tuesday, November the 24th, 10 a.m. in the morning. So anybody is welcome to take that. It's a no-charge workshop. It will be on Zoom, and you can drop us an email or send us a phone message. You can easily get all the details in our new program guide off our website, or if you subscribe to our weekly newsletter, we'll be promoting that in the weekly newsletter as well. So if you want more on advanced care planning, I encourage you to come to the workshop on Tuesday, November 24th, 10 a.m.
Highly recommend.
I have another question, and somebody indicated, I have a power of attorney for care. Is that enough? It is my understanding that the power of attorney for personal care is certainly the document that allows you to speak on behalf of somebody else when they cannot speak for themselves in their own voice, expressing their own wishes when it comes to any healthcare decisions, but not the financial situation. Would you say that that's enough?
Yes, that's very good. So you're absolutely right. There's power, there's a few different documents, right? So there's the power of attorney for personal care, and that is usually healthcare decisions, and shelter is often in there too. So power of attorney for personal care, but power of attorney for property is all the finances and the property and the home and all of that. So oftentimes, so they could be the same person, but they don't have to be, and you would need separate documents for that. So somebody could be, so for example, I have a relative and I'm a power of attorney for personal care for them, but someone else is the power of attorney for finance, for property, and they handle the money. So that you can, they're different documents. It could be the same person, but it's not automatically. So you do have to set that up separately.
Thank you very much.
Yeah. And you could, and then you would be the substitute decision maker too.
Yeah. SDM, substitute decision maker. Lots of big terms. You're the spokesperson.
Shoppers Drug Mart.
Yeah.
is the other. People said SDM.
Neutral. We can't say that. We're vendor neutral.
That's right. Yes, we are.
A general question. I asked them for some more details, but I didn't have really anything come back particularly.
Okay.
But somebody did write in and said, how can we help our parents in long-term care? So you've got a lot of latitude to answer that, Nicole.
Yeah. And you know what? I think that's really hard. For what it's worth, I was trying to find, I know I went to a seminar about long-term care, and there was one study looking at people who, I think it was done in the US somewhere. They were sort of looking at the families not being in long-term care. Was there a higher rate of depression or things like that in the residents? There actually wasn't. So, in some way, I'm not to say that people in long-term care aren't missing their families, but I think it's a double-edged thing. And I think it's very hard on the families too. But it's sometimes the people who are living in long-term care, as long as they have sort of their long-term care family, sometimes some of that loss and missing can be mitigated. But I think what's important is just, if you can make an electronic connection, it is a connection. So it is that voice. It is finding out about what the person is doing and staying in their lives. I think that's important. I think as you are able to visit, for sure, finding ways that it's practical to do so as long as you are healthy. And then advocacy, right? So, I've noticed as well, like being on Facebook and that there's a lot of advocacy that's going on for long-term care reform, and also for giving care partners, recognizing that a lot of care partners are essential and should be treated as such. So if that's something that you find can be energizing and fulfilling, there's a lot of need for advocacy right now. But I think just doing everything, that you can practically do to try to connect virtually and in a distanced way is probably the best thing to do. And don't feel guilty. Don't feel bad. You didn't cause this pandemic. There's no reason for guilt because you haven't done anything wrong. It's just a tough situation and it will pass, and we're doing the best we can. So please be compassionate to yourself too.
Excellent points, Nicole. I'd like to add just a couple more, if you don't mind. Some of this came in through the chat, and these are some ideas. Certainly right now, regarding long-term care, get yourself identified as an essential caregiver. Get yourself in there.
Yeah.
Make sure that the staff are aware of your family members' background, their culture, their history, their interests, what's important to them, what is their personhood. That is the technical term, personhood. But what gives value to them, and how can you bring something that is personalized and important into their care plans? Tell them stories about mom and dad, have pictures in the room, have things of interest. Help the person with dementia explain who they are when maybe words aren't available to them, and that will help the staff interact with them well. So another thought, I'm going to promote another talk for us, is that we have a talk coming up about visiting in long-term care, and it's on Friday, December the 18th, 10 a.m. on Zoom. Same rules apply. You can find out through our webpage, you can find out through our newsletter. And there are some excellent resources about visiting in long-term care, particularly during this time of COVID. And if you are interested in those resources, they're everything from activities to technology to dealing with difficult emotional situations. You can be in touch with the Society, and we can share those resources with you. You don't have to wait until December the 18th.
As a Christmas gift.
Yeah, certainly come and come to that talk on visiting. It's a chance to talk.
Oh, that's great.
Some other comments that came forward, and one of them was that there we are. There were some suggestions that people had made about things to do, and I think this one, if the weather holds for us, might be fun. We've been hiking and apple picking twice. Something that involves the great outdoors, some physical activity, some socialization, certainly gives you the biggest buck for your bang, or bang for your buck, I mean, sorry. Because multiple things to be stimulating. So if the weather holds, go out, smell the leaves, walk through them, look for apples, do those sorts of things. Because
I love that.
Sometimes puzzles can be difficult for people, but something in the here and now that involves their senses can be very positive. Spending time together around the pool. Well, that one I think is done unless you have an indoor pool. It's done for this season, but you definitely want to be entertaining those. Now, people have asked about your slides being available. They would certainly be available via the recording, because you will see on the recording the slides and your face. Those will be shown. I'm not sure if you feel like you would like to share a PDF with us at any point or not.
Sure. Yeah, no, I'm very happy to do that. Yeah, if there's interest, I can definitely share that with you, Robin, and it can be posted or shared Yeah, that would be great. Yeah, because there's some good links on there and things that you might want to save.
Really appreciate that. We did have another comment come in, has to do with long-term care, and somebody who has a relative in long-term care, and they do window visits. And one of the things that they did for their family member was to get a bird feeder, and they've really a bird feeder through the windows.
That's amazing. Yeah. And I think you're right. Like things that connect us to the natural world and that are interesting in a sensory way, but also kind of peaceful and relaxing. Those are great suggestions. I love my bird feeder.
Right.
I
know we're getting low on time, but there is another question here that I think we should address for a minute. And somebody's asking about helping their parents in long-term care when they can't get out and about and they have limited access to technology and they can't do the through the window visit. I only have one idea for that myself. I'm hoping maybe you have some ideas. I would work with the home. I would really be trying to work with the activity and recreation department in the home, with the direct care in the home. I would go to the home itself, the staff in the home, and pick their brains for sure.
Yeah, I think that's a good idea because there's so many ways of connecting with people, especially when it's somebody that you know and love and you know all about them. And it could be just, and if you can share objects with them. So if you could bring in like even a food item that is going to evoke comfort for the person, or a piece of music that that you've really shared, like maybe it was the song that just meant, you always put that on when you were driving up to the cottage, or that's what you always played every year at holiday time. Being able to share that is like being there, right? It's sharing a shared memory and a shared experience. So those are other ways, I think, of being there. If you can't physically be there, is just sharing the experiences that is going to connect and be meaningful. And so probably the recreation therapist could help you, or anyone who's on that team could help you to facilitate that. And you're the only one who could do that, right? Because those things about the person, what's special. And again, I think that was a great suggestion about the culturally significant items. So there might be something that really speaks of home, right? Especially if it's around a holiday time. And so that, the whatever it was that was so homey and just would bring that comfort and make that connection, try to get those objects in there. And it'll be like you're there too. You'll be there in spirit.
Yeah, it's hard. People feel very helpless. And I know that the homes are short-staffed, and I know that they're stretched very thin. I recognize that. I worked in long-term care for 30 years. I heard long-term care. Yeah, you didn't know I was that old.
You started as a candy striper.
So I understand it. Oh, you're sweet. I understand it from the long-term care staff side as well, but it's very frustrating for families. And I think they feel great pain when they can't do what they want to do. Yeah. There is one other idea that I'd like to put out that the Alzheimer's Society does, and it's called the SPARK program. And the SPARK program is very low tech. It involves a telephone. And if somebody is able to have conversation on the telephone, we have trained volunteers that will phone once a week and do social and recreational conversation with the person. So you could possibly contact us at the Alzheimer's Society and look into the Spark program. We would like to do that.
I love that.
Yeah, it's wonderful. The program, we've already received great, we only launched it earlier in the week and received great feedback already.
That's good. Well, I'm glad I didn't know to mention it then. It's brand new. So it's great.
So somebody's asking about applying for long-term care and checking where they are on the wait list. They really have to go through the LHIN. They really need their LHIN care coordinator to speak to that, don't they?
They do, yes. And that's a common question. And that's a moving target too, right? That's always changing all the time, depending on what else is happening in the system. But yeah, your care coordinator is your go-to person for that.
Right.
They can give you advice. Yeah. People ask me a lot of times if I can do anything to advocate. And, you know, for sure, I try to keep the lines open with when I am working with someone, like with the different providers and that. I share information, but usually doctors don't have much pull when it comes to those lists. It's a little bit mystical and magical. Mm-hmm.
Nicole, you've been absolutely marvelous tonight.
Oh, thank you.
For bringing such a genuine warmth to people who are on our talk tonight. I know that they know that you care. And what I'd like to do, I know you're going to share a PDF of your slides with us. That's great if anybody would like that. My thought is that if you could possibly send that to me sooner than later, I will attach it to the evaluation that I'm sending out. So everybody will get a copy of the slides. So we will send you an evaluation tomorrow. And with that evaluation, I will send a copy of Dr. Dydyk's slides. I will send some information on the Spark program that we just mentioned. I can attach that for you as well. And don't hesitate to be in touch with the Alzheimer's Society. We are here to help, and we are certainly open. We may not be at the office in person the same way, but we are open for business. Yeah. And with that, I have to say that at 7:40, we kind of need to wrap it up now. So
let's do this again sometime, Robin.
I will set that up. You will be so surprised how quickly you get another request in.
No problem.
So thank you to everybody on the team tonight who made this happen. I really appreciate it. And thank you to everybody who showed up and stayed with us tonight.
Thank you.
What you're doing, you might not get thanked for, but we at the Alzheimer's Society, we know what you do is invaluable, and we thank you for being there. I'm going to end the program for the evening, but thank you so much, everybody. Take good care.